Oh, yeah, never mind. I was reading the practice part.
Thank you. All right. Hi, everyone. Thank you so much for being here. I'm going to pause for interpretation really fast.
En unos momentos aparecerá el icono del globo terráqueo en la parte inferior del lado derecho. Van a tener la oportunidad de seleccionar Spanish para escuchar al intérprete. Si quieren, pueden ponerle mute al sonido original, pero si no, solamente con presionar Spanish van a escuchar al intérprete. Gracias.
Okay. Thank you, Melly. All right. And again, thank you everyone for being here. My name is Leah Raffa. I use she, her pronouns, and I am with the DPS Substance Use Prevention Program. We host these webinars every Wednesday on the second Wednesday of every month, and we bring in an expert from the community to talk about something that is relevant to DPS youth, the community, substance use prevention, all of the things. And today I'm really excited to introduce our guest, Amanda Carter. Amanda is with Jewish Family Services. She's a dedicated clinical social worker and counselor specializing in family dynamics and school-based mental health interventions. She has started at JFS in 2012 and currently is the program manager overseeing a team of therapists in 16 schools throughout the district. So Amanda, thank you so much for being here. I'm going to turn it over to you.
Sounds great. Thank you for having me and allowing me to be a part of this. I really appreciate it. I wanted to just take a couple moments, just to say thank you all for being here. And there should be a link coming through, I believe, just to kind of get us started out to figure out who all is participating. So I have experience working with, children all the way through adults. So just really wanting to see who is joining us today so I can meet the needs of everybody. So that should be coming along. And then I will also kind of keep an eye on the responses of that. And then what I'm going to do is get ready to share my screen. So hold on just a moment. All right. And then Leah, can you confirm that you can see that?
I can see it, and the link is coming in right now. Sorry, I'm
Perfect.
a little slow today.
That is okay. So I'll kind of keep a little bit of an eye on that. So I'm gonna shrink this down just a little bit. And then as I'll do my intro and then we can kind of go back to that. But today we're going to be focusing on just the community, the mental health issues that are facing Denver youth and wanting to just talk about some of the resources that are available, as well as some strategies and supports. So as we're kind of getting started, just to kind of share a little bit about myself. I graduated from the University of Colorado with a major in psychology and a minor in sociology, then went on to the University of Denver's Graduate School of Social Work, and I received my MSW. I'm now a licensed clinical social worker, and I have been working with the Jewish Family Service school-based team, Kid Success, since essentially 2012. So I started working with this program during my internship. I had no idea that school-based therapy was a thing. So learning that students can have access to care in the schools, looking at ways to overcome as many barriers as possible has just been something that's really great. So just a little bit about my experience and things that I've been working with. So I've been working in anywhere from a K-8 school to elementary and middle schools. Also with my time with Jewish Family Service, I've been a full-time school-based therapist. I've also overseen interns from graduate school programs, mainly LPCs, so professional counselors, as well as social workers going for their graduate degrees. And then the last 2 years, I've been managing the program. And while managing the program, I've also been in the schools too. So I'm currently at one of the schools that I'm at twice a week. So I'm currently still working with everyone and having some of that on-hand experience too. And then just a little bit too. So the clinical therapy aspect, I provide clinical supervision. Animal assisted therapy is one of the modalities that I've really enjoyed working with. So I always like to find good ways to bring in my little furry friends here. So I've been doing animal assisted therapy since 2016 when I was working at Samuels Elementary School, and started with my Rottweiler, who was with me for 5 school years. And then we've got a younger guy we're working on getting trained. And then I also have an older dog who attends some sessions with me here and there. And then, so all of these pieces are just thinking about other modalities, things that we can use. And within school-based therapy, essentially what our role is an outside clinical therapist housed in the school. So we're going to talk a little bit more about that. So more specifically with our program, so Jewish Family Service, if you have not heard of it, we are a nonprofit and we have been around for a little bit over 150 years. And the Kid Success Program is our school-based therapy program, which is who I'm representing. And this is our 29th year providing school-based therapy, which is really exciting. And we are currently in 15 Denver public schools and 1 private school. And then we also have 2 pending Adams 12 schools that we're looking at supporting with some refugee services. So within our team of Kid Success, we are made up of 25 staff members, and that includes program manager, clinical supervisor, a lead clinician who has a caseload as well as oversees and provides clinical supervision. We have 19 master's level licensed and pre-licensed therapists. So they've all completed their master's degree and are either working towards their license or have their licenses. We also have 1 case manager who is bilingual. We have a refugee navigator who works specifically with our refugee populations. And new to us this year, we have a case manager intern. And then we have 1 contract child adolescent psychiatrist, as well as newly starting as of this past week, a psychiatric nurse practitioner. And then we have 1 therapy dog on our team. So over the last 29 years, our team has grown and changed and developed just as the mental health needs keep changing and making sure that we can support the needs of, students in Denver. So listed here are the schools that we're currently in. Each year, it kind of just depends, but we really look to aim at who we can support, where the needs are, and then really looking at what schools maybe don't have as best access. Where are there some gaps in services, things like that. So there might be some other schools that are, working with some other contracted agencies that could also include Wellpower, Denver Health, Maria Drost, and then there's several others. So we're just one of the partners that works with Denver Public Schools. So I'm going to X out of this really quickly to see if I can take a quick look at our poll, just because I really want to make sure that we can tailor this to everyone who's here. So in terms of our responses, let's see where we're at. Hold on just a moment. Thank you all for your patience. Everything is kind of right in the way. There we go. So it looks like we've got some folks that are in elementary school, middle, and high. Perfect. Mainly parents and teachers. And then some of the goals, things we're hoping to get out of today is dealing with aggressive behavior, new strategies, how to support students during school. All right, perfect. And then what are the top 3 stressors impacting the mental health in our communities? So some of those things that you guys shared so far would be social media, parents working long hours and stress, the academic pressure, social media comparison, family responsibilities, workload, relationships, and substance use. And it sounds like, for the most part, everyone who's joining us right now is feeling pretty comfortable with being able to discuss, you know, your own students and being able to have open communication, which is really great. So I'm really glad to hear that. Okay, so as we're kind of thinking about those questions, thinking about elementary schoolers, middle schoolers, high schoolers, things are going to be a little bit different between the ages, and thinking more with middle schoolers and high schoolers, that's more of where some of those concerns around substance use, also more peer dynamics and things like that are coming up. So thank you for sharing your initial concerns, some of those things that you guys are thinking of. I want to go through some statistics. So these are pulled from just a couple websites and some other resources. So this is more just kind of generally speaking. So overall within the youth across the US. So I'm sure, as everybody knows, COVID has had a very large impact on not only children and adolescents, but adults as well. But in 2021, experts did state that there is a national emergency for mental health with children and adolescents. Also noting that children, adolescents, specifically females, as well as BIPOC communities, are more disproportionately affected by mental health, specifically with COVID compared to adolescent males, as well as youth who are identifying as white. And then in terms of the emergency department, they've noticed that suicide attempts among youth has increased compared to the same period in 2019. So noticing that there is a 12 to 17% ages, 12 to 17 increased by 51%. And then in 2020, noticing just the number of increases of mental health emergency visits has increased. So just really noticing that specifically with COVID, and that's more so when I think everyone has started looking a little bit more in mental health and its effects on COVID, and really seeing that these things have been here for a while, but really not sure, what the correlation is. And I think with us having, COVID coming along, we've been able to recognize some of those pieces. Then specifically with Colorado, here's some details. But just, I'm sure as everyone has seen, maybe across with their own youth or in talking to your own students, hearing from peers and things like that, just that there's been some negative mental health outcomes that's been increasing over recent years. Also noting that there's been a higher increase of levels of depression and depressive symptoms that also has been increasing suicide rates. And then, oh, it looks like I've got a couple different duplicates, so I apologize for that. So, there we go. So some of the observations specifically that I can speak to my team has been noticing with mental health needs. So these are just some of the diagnoses that we have seen with the youth that we are supporting. So anything from adjustment disorders, anxiety, attachment, attention-related disorders, that can be ADHD, that can be more impulsivity, that can be inattentiveness, or both. Some bipolar, grief and loss, impulse control, conduct disorders. One of the things that I had noticed with the questions was more of like aggressive behaviors, as well as depression, substance use disorders, trauma, as well as suicidal ideation. So those are the things that my team specifically has been seeing, and I'm sure across, the board are also things that are coming into play with that too. So as we're looking at some of these diagnoses and presenting concerns, when we're looking at adjustment, for instance, if we're looking at elementary schoolers, adjustment can look as simple as a change in their routine, anything from a snow day to a long weekend to being sick and missing a few days and trying to come back. That can be really difficult for kids. And sometimes it could be, just navigating how to figure out, how to overcome it. And sometimes it's a little bit more difficult and they're just needing some other strategies. Could also be adjustment from one year to the other. or if there are students who have multiple teachers and they're going from one class to another, depending on the age, and that could be elementary school through middle school and high school. But just the adjustment of going from one class to another can be really hard for some. And then anxiety can be brought up for a multitude of different reasons. That could be brought on from peer relationships, social dynamics, things going on at home. That could also be related to specifically academics, test anxiety, performance anxiety, maybe sports, things like that. And noting that all of these things are going to look different from one youth to another. So we're going to talk about that a little bit here too. Attachment related disorders, attention related disorders, bipolar, like I had mentioned. Grief and loss is something that we've been seeing quite a bit too. Grief and loss can be anywhere from, losing someone to death. It could be somebody moving away, the loss of a friendship or a relationship. That can be deeply impacting our youth as well. Impulse control conduct disorders. So that's more of, struggling with social dynamics, aggressive behaviors, not knowing what to do with our emotions when we have them. So really looking at what can we do if they're feeling dysregulated. And then depression, that goes into some of those other pieces too. So kind of going back a little bit, things that we're seeing at the elementary level, adjustment, like I mentioned, and we're going to talk about the differences in cultures, different components. So I want you guys to think back to maybe when you guys were younger growing up and when you all had peer conflicts and what emotions came up for you guys then. Thinking about, was it wanting to isolate from our friends? Was it getting really upset with our friends? How were we navigating that? And then thinking about now adding in social media components, adding in the ability to text a friend and, have almost instantaneous responses, and how the impact of technology and social media use has impacted that. So thinking about, for most of us, we might not have had the social media component or the tech component. So that is something that our youth is really focused on right now, and that's their line of communication. So if they're not having friends text them back immediately or things like that, those can be really difficult. And for us as adults, that might not be the biggest thing for us, but for them and their worldview and their perception, they haven't lived as long as we have. They don't have as many experiences as us. So noticing that for them, that is a really big deal, and recognizing that we need to meet them where they're at. So that's also going to be what we talk about today too. So some ways that we can support, and we're going to talk a little bit about recognizing some of these specific diagnostics, some of the symptoms that we're noticing too. So when we talk about connections can be anything from who are our students hanging out with at school? Do they have connections outside of school? The friends that they see in school, do they have the ability to communicate with them outside of school, or for the most part is their connection at school? And then when we think about outside of school, what does our students' communication and connection look like with members of their community, members of their family? So thinking about when your students are coming home from school, how are you connecting with them? Are you kind of asking how your day was and they're saying, oh, fine, or I don't want to talk about it? What is that looking like? Also empathy meaning, I hear that this is really hard. So like I was just mentioning about, some of those peer dynamics. For us, it might not be that big of a deal, but for them, it could be really hard. So thinking about ways that we can still empathize with them and let them know that we hear them. We might not agree with where they're coming from, but letting them know that we hear them is so, so important. And that kind of goes into acknowledgement. Thinking about how can we acknowledge how they're feeling, and also maybe talk about some other strategies or other ways that they can overcome it and navigate it. Also, thinking about clear expectations. So we're going to talk about this in just a little bit, and predictability and talking about those, but I want to go back a little bit here to some of these observations. So thinking about anxiety and depression, for instance, those can be masked very differently and they can present very differently. So your student might be more shut down, or more withdrawn. They might seem like everything is going okay. We think about, are our students internalizing or externalizing? So one of the comments from the poll was, navigating aggressive behaviors. Oftentimes when we're seeing aggressive behaviors, that's coming from dysregulation and them not knowing how to effectively articulate how they're feeling. And they're kind of just figuring out, what do I do in this space? And oftentimes that's where aggression comes into place, outbursts, meltdowns, tantrums. That's kind of what we're seeing. And it's, they're not having those skills. So a lot of those pieces are, recognizing where they're at. And with anxiety and depression as well, those can also look like anger. So anger is often masking other behaviors and other emotions mainly. So thinking, is there something else going on? And instead of, wanting to push and kind of get down to the bulk of it, really just listening and hearing what they have to say. I think a lot of times as adults, we want to be the fixers. We want to take their pain away. We want to fix it for them. But oftentimes they just want us to listen. So being there and hearing them, and yeah, that sounds really difficult. I can hear how that's really hard for you. We don't always need to have the right answer. It's okay for them to hear that we hear them. A lot of times they don't want to come to adults because they think, oh, they're going to tell me I need to be on my phone less, or I need to hang out with somebody else. But what they're really wanting is just a space to debrief and hear. And it's always okay to say, do you just want me to listen, or do you want some feedback? Those can be things that we can ask our students as well. That's something you can do when they're younger, all the way up through, those teenage years into adulthood. And even with our own friends that we have as adults, just asking, yeah, do you want me to be a listening ear and just hear you out? Or are you open to some support and what that looks like? Thinking about attention as well. So attention can also tie into some of these other pieces. So attention, when we think about, difficulty sitting still, difficulty following directions, needing a lot of reminders. Some of those pieces I think we often forget about, how old our students are compared to our lived experiences. So some of the work that I do with Jewish Family Service and with the Kids Success Program is that we facilitate some evidence-based parent groups, which is through the Incredible Years. And one of the things that really stood out to me, I want to say 5 or 6 years ago when I attended this training, was once we ask our child to do something, waiting, and this is more for elementary age students, so we'll talk as we get more into middle school and high school, but when we're asking our students to do something, even if it's hang up your coat, giving them a couple seconds to let that absorb into them. Thinking about, we always have a million things going through our minds and we can multitask and do things, more than one thing at a time. Whereas our students don't necessarily have that ability yet. They're still learning. Their brains are still growing. So at that elementary level, making sure that we're giving clear and concise communication as to what we're needing them to do. So it could be as simple as, hey, please hang up your jacket. And this part is harder, but giving them 5 seconds before we re-ask them and before we redirect. 5 seconds can seem like a very long time, but oftentimes that's the amount of time that they need for it to process. Also with the littles, more elementary school age, but instead of giving them a string of things to do at once, of hang up your jacket, put your shoes away, put your backpack here, do this, do that, giving them 1 to 2 things to do at a time is also going to be setting them up for success a little bit more. So that way they're not as anxious about what were the 5 things that I was asked to do. If you're giving them 1 or 2 things, that is more likely for them to retain that and then be successful. So really thinking about, who your kiddo is. Do they need 1 task at a time? Do they need more? And then also giving them that time to process and think through, did they hear it? Did they need another reminder? Where are we at? And then with middle schoolers and high schoolers, they should be at that age. And also every student is different. So thinking about your own student's developmental level, but checking in with them. And when you're asking them to do something, also asking, for them to repeat back what they heard you say. You can do that when they're younger too. And it's not to nag them, but it's to make sure that you guys are on the same page, that you guys both heard the same thing. And that's also another way to make sure that expectations are being met. And that way, that communication piece. So that goes into that clear expectations and things like that. So with all of our age groups that we're talking about, elementary through high school, making sure that we're being really clear about what we're asking our students to do. Okay. So what we're going to do is talking more about like those depression and things like that. We talked a little bit about how anxiety and depression can also, mask as anger, as well as with ADHD, that can look like anxiety as well as anger too. So a lot of these different symptoms that we see that are, mental health components are often blending together. So sometimes it's a little bit hard at the beginning to figure out, like, is there some depression or is there anxiety? Are they just really angry? What's going on? So really taking the time to figure out, what's going on and learning more around, what are your students' experiences? How are they doing academically? Are they feeling overwhelmed? If they're overwhelmed, let's see if they want to talk through it. And sometimes it's, I have a lot on my plate and I have extracurriculars, and really looking to see, let's just talk through it. And sometimes talking through it can help as well. Trauma is something that, looks different for everybody. So trauma is very subjective. What could be traumatic to me might not be traumatic to somebody else, and knowing that those are all individual experiences. So maybe our student lost a friend because they got in a fight and their friend said, I don't want to talk to you anymore. Or for maybe middle schoolers and high schoolers, maybe they just broke up with their in their first relationship and they're feeling heartbroken. That can be viewed as a trauma to them. Or it could be something more intense as, immigration trauma and familial trauma. Maybe there's unsafe environments going on in their community or in the home, and how they are protecting themselves is by putting up their guard. And it might look more like frustration and anger. It might look more like impulse and conduct and attention. So just noticing that some of these pieces are all intertwined, and it's not always a clear cut, this is what it is, this is the one-stop shop for how to fix it. With the majority of the things that we're seeing, a lot of it's coming down to those connections. So asking your students, who are some people at school that they can talk to? If you're having a tough day, who are two staff members you can talk to? Is it the teacher? Is it, the custodian or facilities manager? Is it the gym teacher? But really looking to see who your students can connect with, not only at home, but at school too. And it's okay if they don't want to talk to parents right away. Sometimes they just want that separate space. So connections. A lot of schools have resources. So asking your schools, what mental health resources do you have? They might have school-based services. A lot of the schools also have Denver Health school-based clinics, and there's mental health services there. Sometimes also the school staff with the school psychologists and school social workers can provide some support, but it's always helpful to know what supports does your school have. And depending on what those supports are, we can also provide supports in the community. So depending on what your family's needs are, but checking to see what those connections can look like. Right. And then with that empathy piece kind of going through as well, just hearing what's coming up for them. And maybe I think with some of our students, they're afraid to talk to parents because they're afraid of getting in trouble. That's what I hear a lot of our students saying is, well, I don't want to talk to mom and dad because I don't want to lose my privileges, or I don't want to lose screen time. So really talking with your kids around, we all make mistakes. We all have hard times. It's okay to talk about it. And, when they bring it up to you, just hearing what they have to say and stopping and thinking before we respond. So there is a curriculum through, it's called Conscious Discipline. And what they talk about is they talk about different brain states. So they talk about the survival state, which is fight, flight, freeze, all of those there. Then our emotional state, and then our executive functioning state. Thinking about our survival state, it's, am I safe? We might see our students crying, they might become more aggressive. They might be hiding under tables. They might be shutting down and going into their rooms. Those are all ways of, how they're processing. And that's telling us that they're maybe in their survival state. Their emotional state is the question that is often asked just to kind of connect it. So survival state is, am I safe? Then the next one is our emotional state. And that question that we're often asking ourselves is, am I loved? Thinking about those connections. So maybe they got into a fight with their sibling, or they got in trouble at school, something happened. They might be really emotional and might be communicating, but just still dysregulated. Then that emotional state, that executive functioning state, is, what can I learn from this? That is the state that we want our students as well as ourselves to be in the most. So with our executive functioning state, it's, what can I learn from this? Problem solving skills, critical thinking skills. So if our student is really dysregulated and shut down, we can't ask them to problem solve at that moment in time. We need to make sure that they're in an executive functioning state so we can support them. And besides them being in their executive functioning state, it's important that us as adults are in our executive functioning state too. So think back to maybe being at home and, they're feeling pretty frustrated and they're getting really angry and they're not following directions. They're screaming, they're stomping, whatever that might be. And as caregivers, parents, adults, staff members, sometimes we can get frustrated too. And when we, lose our cool or snap back at them, that's dropping us from our executive state into our emotional state or survival state. So for us to be able to support them, we need to be emotionally regulated too. So ways that we can do that, taking breaks, naming our emotions, and practicing those things, and also demonstrating that for our students. So that can be, man, I'm frustrated, I need to take a break. Or, I'm really upset right now and I need to cool down. Let's touch base in 5 to 10 minutes, and taking a timeout to calm down. And timeouts to calm down is focusing on regulating us, and we can model that behavior too. So that is really important with, any age range. So if we have a moody teenager and if they're really upset, checking in like, hey, let's take a 10-minute break. Let's check in 10 minutes. And if you need more time, that's okay. But recognizing that they might need some time to calm down too. And that's a good way to kind of separate it. And if we're trying to problem solve when we're really dysregulated, we find that often makes things more difficult too. Okay, so as we're kind of thinking about some of these other ways of supporting, talking about clear expectations, making sure your students know what is expected of them. What is their routine? And that's predictability routines as well. Do they know the routine in the morning? Do they know when their homework is due? Things like that. At home, do they know the household rules? Things like that, making sure that your kids and students know what that is. Sometimes we think that they recognize it and we say behave, but they don't always know what behave means. So we need to break that down and define what that looks like. So clear expectations, that can be, when you come home, this is what you're going to do. If you need to talk about something, if you're frustrated, this is how you can communicate to us. If you are implementing any timeout strategies or things like that, or if there's consequences in home around, loss of privileges or loss of technology, whatever that is, making sure that you're talking with your students around XYZ equals loss in privileges. So that way they recognize what that looks like. So to them, it's not coming as a surprise. Predictability routines, that also from the previous page, that comes back into, sorry about that. That comes back to, making them feel safe and knowing what to expect, that adjustment component. If every day in the morning is different, that's going to be harder for them to know what to expect. That's why, school is so, we have math, then we have reading, then we have recess. Kids know what to expect. We also want to make sure we're doing that at home too. So that way they know what's coming. that can decrease their anxiety. And also with having predictability and routines that creates the feeling of security and safety, and then can decrease those components. All right, I'm just kind of looking at those question and answers. I will come back to that in just a second. I just made sure to take a look at that. And then collaboration. Talk with individuals at school, making sure that you have connections with school staff. So that way, if there's something going on at school, they're there to help you. And that can also be touching base with guidance counselors, things like that. So the question was talking a little bit more about animal-assisted therapy. I think that's fantastic. So within my school-based team, our therapists utilize a lot of different therapeutic modalities. We utilize animal-assisted therapy. We also utilize EMDR, which is an acronym for eye movement desensitization and reprocessing. That is utilized a lot with trauma. We utilize non-directive play therapy and directive play therapy, art therapy. We also do a lot through, through reading books. So I can talk about some of the favorite ones that I use. I think any student who has worked with me can probably recite a lot of the strategies that we worked on, but specifically animal assisted. So animal assisted therapy is, I'm obviously biased to this, but yeah, there's a huge animal connection, human animal connection. Animals are very attuned to our emotions and our feelings. They obviously can't communicate with us, but there's been a lot of research that has shown that having the presence of an animal can decrease anxiety, symptoms of depression, can create connections. So ways that my team has utilized animal assisted therapy. I can speak excuse me, directly from my experience with the work I've done. So I have utilized my Rottweiler when he was with us for 5 years in elementary school. I utilized that with some of my kids who have experienced trauma and helping them advocate for themselves. So that can be as simple as teaching your dog a trick or having them listen to commands. So I would have, first graders, second graders asking this 80-pound intimidating Rottweiler to sit, lay down, and the dog is listening to them. So that's increasing their confidence and having them understand that we can use an assertive voice. So that's something also that I've done a lot with students who struggle with peer dynamics and peer struggles and have bullying behaviors is let's learn assertive behaviors and assertive communication rather than aggressive communication. And I've actually found that working with students who struggle with bullying behaviors and aggressive behaviors have a harder time learning how to utilize that assertive communication with an animal. And they feel really uncomfortable about it. And there's more anxiety that comes out. And learning how we can use a strong voice and get our points across. Also, with some of the work that I've done with animal assisted therapy, this deviates a little bit from some of those big pieces that we talked about, but it could also be, if you don't feel comfortable talking to the therapist, whisper it in the dog's ear, let the dog listen. And then, that way they're still processing, sharing, and they're not holding on to it themselves. Some other things that I've done a lot with students who maybe aren't as open to communicating about their own emotions, or maybe they're so disconnected from their own emotions. We do something, it's a strategy that I do with a lot of my students, but we call it the feeling gingerbread person. So we have an outline of a gingerbread person and we talk about what makes you happy. We list through all the things that make them happy. Then we talk about, if I were to look at you, how could I tell that you were happy? And then we illustrate it on the gingerbread person. Then the next thing we do is we talk about internally, I can't see this, but how does it feel for you when you're happy or anxious? So with my students who are so disconnected, we have an outline of a dog and it's, hey, let's look at Coda. How can you tell when Coda is calm? How can you tell when he's maybe anxious? So having them recognize emotions in the animal, recognizing emotions with other people, because sometimes they're so disconnected from themselves that they don't know how to name their own emotions, but they can maybe see it on somebody else's. So that's something that I've done a lot is, what do you think makes Coda feel anxious? How can we see? He can't tell us, but let's look at his body language. Let's look at his breathing. Let's look at these pieces. Some other things that I've utilized with animal assisted therapy is I used to have therapy bunnies. And if you don't know a lot about rabbits, which I did not know a bunch before I started working with them, but we all know that they're prey animals. They're naturally anxious beings. So I had my rabbits working a lot with some of my kids with anxiety and talking about, what is it that they're needing from us when they're feeling calm and comfortable? They're coming up to us. Then asking the students, what do you do when you're feeling more comfortable? How do you communicate with somebody else? Those are some other ways that we can utilize that. And then also with animal assisted therapy, talking about healthy boundaries. So boundaries around, personal space, as well as, if Coda wants to get up and walk and lay on the other side of the room, that's okay. We're giving him his space. And then turning it around and what do you do when you need space? Asking them, but kind of using the animal or the dog as an example, as, this is what they do when they're feeling that way. Or utilizing, some new tricks or agility skills and thinking about, there's some agility where it's like they have to weave in and out between different posts. So you can put sticky notes on each post and thinking about what are some goals you want to work on? How can we work on navigating and weaving through? Let's work on teaching Coda how to weave through. And then each time we weave through, we go back to that question and their goal around what do you think you need to do to navigate this obstacle in your life? So kind of taking the pressure off of the student and having, an animal there kind of buffers that. And I've seen a lot of really great growth with students being more open and talking through when there's, something else in the room to kind of take the pressure off of them. We can also do a lot of co-regulation. So I know in the past couple of years since COVID, we've talked a lot about calming strategies, breathing skills, mindfulness. There's a lot of things that you can do with your animals. So we do some co-regulation around, putting your hand on their side. Can you match their breathing? What do you notice? Also, grounding strategies. If a kid is dysregulated, let's look at Coda. What are 5 things you notice about him? What are 4 parts of him that you can touch? What does his back feel like compared to his ear? And just noticing those pieces and the sensory components to ground ourselves and bring ourselves back. That's something that you can obviously do with an animal. You can do grounding strategies without animals too. So grounding strategies, those are some of the favorite ones that I like to teach students first. And, that's a good one around if you're really overwhelmed, focusing on what's in the room behind you and thinking about your 5 senses. So name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing you can taste. It seems like, why is this helpful? But you're bringing them out of their minds and back to their surroundings. So that way they're grounding themselves, making sure their feet are flat on the floor. If they're sitting in a chair, they can feel the chair behind them and underneath them, but really bringing them back and centering themselves. I do that a lot with students who are feeling really anxious or really overwhelmed, is name 2 things in my room that are green, or, what is your favorite calming smell? Things like that, but also like the tactile of, like I can feel my jeans, I can feel my shirt, I can feel my hair. We're bringing ourselves back to the here and now. Those can be some things that we can also work on there. All right. So thinking about some additional supports resources, like I mentioned with that connection component, I think it's really great to learn more about the supports that your schools have. School social workers, school psychologists have a lot of really great resources. And then there's also resources similar to Jewish Family Service and others that contract. So noting what is available to you in school and what supports are available to you and to your students. In our schools right now, the schools that we're in, and I'm going to go back a little bit, and I think this is really helpful just to kind of share with everyone and just talking about some of the mental health, ages of consent and things like that. So in the state of Colorado, youth can consent to their own mental health services at the age of 12. So that means we have middle schoolers and high schoolers who, maybe aren't feeling comfortable talking with their parents and they don't even know how to bring it up, they can come and talk to us. And if there's no safety concerns, we can provide them that support. We always encourage family involvement, but we know that every family is different. There's cultural components and things like that. In our elementary schools within our program, anyone who's under the age of 12 has to have caregivers consent, but noticing that, maybe these resources are already in place and maybe your child is already accessing these resources. And if they are, that's great. One of those pieces is we want them to know that they can advocate for themselves too. And of course, we want our kids to come to us, but we also know that sometimes it's hard when we're really close to the situation. It's like we're sitting in the front row of the movie theater and we really just need to take some steps back. So those are some of those pieces. And then I also want to check in and see, Haley or Leah, if now would be okay for more Q&As and just kind of opening it up more. And then I'm also going to kind of go back to those questions to answer a little bit more specifically.
That sounds great, Amanda. And yeah, like I said, please go ahead. Any questions you have, put it in the Q&A and we will make sure that Amanda answers those.
Perfect. And then I am able to pull up those other questions. So I'll keep an eye out on the Q&A as well. I've got just a little screen, so thank you all for your patience. But yeah, dealing with aggressive behaviors. I think with aggressive behavior, with each age, it's going to vary very differently. But trying to understand, is there anything that has changed recently? Have there been any adjustments, changes? Is there something else going on? And really trying to see if we can learn on identifying what is activating them or triggering them and learning more around it. And with the younger students, wanting to figure out, making sure that we're focusing on pro-social interactions and things like that. And focusing on, instead of no hitting, we're keeping our hands to ourselves, making sure that if you have expectations at home, that you're communicating with them around, if we're hitting our sibling, we're going to lose screen time or whatever that is, but making sure your kids know what the expectation is and making sure that we're following through with those as well. With aggressive behavior, before we're kind of jumping in and, providing consequences, really just asking them, help me understand what's going on. I think with a lot of these pieces, it's that connection component. And then, yeah, strategies. I think a lot of that, strategies can be anywhere from, I personally really like utilizing books and things like that. So I'd be happy to put a list together of a lot of the resources that my teams like to use in their sessions, things like that. I think, the biggest one is, there's so many, so I'm just trying to kind of parse through all of those. But a lot of the biggest pieces is like, let's just work on naming the emotion, and kind of that naming piece is going to be the first part. So maybe they're really upset and they're shutting down. Let's work on, can you draw how you're feeling? Or do you want to write down what you're feeling? Do you need to scribble it out? Let's talk it through. And then supporting students during the school. I'm wondering if this is maybe from one of our teachers, and that's totally fine. But that's going to come back to, hey, just checking in. This is what I'm noticing. What do you need? Asking the students, what is it that you're needing? And maybe it's a realistic request. Maybe it's an unrealistic request. If it's an unrealistic request, I bet that would be really nice. I would love to, curl back up in bed and go home too. Unfortunately, we can't do that. What is something else we can try? I'm going to come back to our Q&As over here. Yeah, so talking a little bit more about the other services JFS has. So Jewish Family Service, we have over 30 programs within our agency. So any youth that works with our Kid Success program, they are more so fast-tracked into some of our other partnerships that we have within our agency. So we have a food pantry, we have employment services, and that can be anywhere from, helping work on resumes to interview skills, to helping you apply for jobs. And we're also working with our employment services to bring that into some of our high schools that we're partnering with. So with our high schoolers that want jobs, as well as caregivers, families, we have a community resources for stability program. So if we have families that are, struggling because of health reasons and they miss utility payments, sometimes we have donors that can help with that. We also have rapid rehousing. We have an outpatient mental health team. We have a refugee mental health team. So our mental health, we probably have 6+ programs. So we're out in Boulder. We have refugee, Russian mental health, our school-based program. And then we have another program, which we are kind of revamping a little bit, but that's going to be really good for youth all the way up to their mid-20s. So it is talking a lot about resiliency and things like that, and teaching them financial skills, things like that. We also have some vocational training, which is new to our agency over the last few years. So wanting to take some other learn some new skills and some strategies. We also have our Holocaust program. We have our Aging, Caring Connections, working with older adults. We have our disability services. We have, in addition to our food pantry, we also have a mobile food pantry. So they'll try to go to some of the areas that, food is more scarce and the resources aren't quite there. So those are some resources as well. Talking a little bit with our school-based services. If we have students who are needing mental health resources in addition to just talk therapy, maybe we need an evaluation, or maybe medication is something we need to look into, or higher levels of care are something we need to look into. Our students that we work with can utilize psychiatric medication services for evaluations, for psychoeducation, which is really great. And then within our school-based team, we also provide parent teaching courses, coaching. We can also support with supporting schools and teacher supports, things like that, classroom wellness groups. There's so many different programs within JFS. Those are the ones that I would say we as a team utilize the most, but our case manager works with all of our programs. So if we have a family who, for instance, even lost their Medicaid, or they're not really sure what to do, we link them to our case manager and she can help with that. We can also help with, understanding how to navigate the housing process, things like that. So we really try to be as hands-on as we can, while also giving the autonomy to our clients and individuals that we work with. And then I will work on getting that book list available. I can tell you right now, just because I was just doing this with one of the students I was working with today, for elementary schoolers and even some middle schoolers, depending on their age, there's an author by the name of Diane Alber that is my absolute favorite. She has a ton of books around emotions. And the first one that I start with all of my clients is, there's a book called A Little Scribble Spot. And it talks about, we have all these emotions inside of us. What do we do with them? And parsing through each emotion, learning about each of them, and then recognizing all these emotions are inside of us. It's not a bad thing to have these emotions, but what do we do when we have them? So they have like a plushie. So like this is kind of like their trademark with how they do it. But they have all the different emotions. So, they have emotions for anxiety and everything like that. I've done this with my middle schoolers too. But they have books around each one, and each of them have coping skills in the back. So, how to manage your anxiety spot, what to do when you're feeling anger. And, those are just some really good ways with the littles to teach them about their emotions. And I work with high schoolers and adults too. I utilize some of those skills as well. And sometimes I practice those, just through my daily life as I'm navigating things too. So Diane Alber is one of the really big ones that I utilize with elementary schoolers, some middle schoolers. And then I will also work on finding some resources to pair together for some of those middle schoolers and high schoolers as well. Are there any other questions that people have that I can answer for you? And if not, that is okay. So what I will do is I believe that Leah, did I send you the post survey link too? Perfect. Yep, if we can get that sent out. And then I will also, once I work on updating the slide deck to more of the details around what we talked about, I can put my contact information. So if there's any information, anything like that that you guys have, I would be happy to answer it. But I really appreciate Leah and Haley inviting me to this. You know, working with students is a huge passion of mine, and being able to provide school-based services is fantastic. And it's really great to be able to support students when we're in school, because we know that there's barriers, and being able to meet students where they're at is most important.
Thank you so much, Amanda. This has been amazing. I was personally trying to think of, I'm like, what questions do I have? And I thought of a bunch and you answered all of them. So this was really amazing. I really
Perfect.
appreciate you. We will be sharing out a follow-up email to everybody that includes, I'll include your survey link as well as a link to this recording in your slides and any other resources. So thank
Perfect.
you
Yeah.
everyone for being here. Thank you, Amanda. And I hope you all have a wonderful rest of your day.
All right. Thank you.